Hi, I'm Dr. Lana Butner, and I'm a naturopathic doctor and acupuncturist here in New York City. Naturopathic medicine is holistic medicine. It's an all-encompassing way to look at you, your health, and how you have potentially developed the symptoms that you have. With naturopathic medicine, we look at a wide range of factors. We look at your stress levels. We look at how you're sleeping, if you're getting quality sleep. We look at your diet, which is so important. And we also look at your exercise. So everybody asks me, are you a real doctor? And the answer is yes. I went to a 4-year accredited medical school. We go through the rigorous training. We work on cadavers. We have 4 years of clinical training as well. 2 separate board exams. The exit exam is 3 days long. It's definitely medical school. What differentiates an MD from an ND is the extra nutritional training that we have, the extra homeopathic training and acupuncture training that we have. Our first 2 years of naturopathic medical school, we go over all of the same basics: biochem, anatomy, physiology, pharmacology, which a lot of people don't realize. Not only that, but we learn how pharmaceuticals can interact with different herbs and foods so that we're not putting the patient at risk. Naturopathic doctors can also prescribe pharmaceuticals in certain states, and that requires a DEA license. And so a lot of people think that we're, the hippie doctor that just gives you herbs and says everything's gonna be better if you eat more greens, and that's not necessarily the case at all. Every naturopathic doctor has their personal stance on pharmaceuticals. I personally believe there's a time and a place for everything, and I think that you could find a happy balance. With my medical training and knowledge, I know when is the right time to bring in an antibiotic, or when is the right time to bring in an anti-anxiety when somebody's going through a really, really hard time or a transition. Taking lavender is not gonna help when you're really, really in a bad place. Another thing that I really like to do with my naturopathic patients is help them regain control by lessening their dependence on pharmaceuticals. A lot of times we'll go through specific tapering protocols, very carefully monitored by the way, so that they can rely less on the pharmaceuticals and more on their own body. If you have questions about naturopathic medicine, I'm available. I'm Dr. Lana Butner, and I'm a naturopathic doctor here in New York City.